What have you seen so far that really raises an eyebrow with you so far?
I think it's a great question. We were lucky enough to partner with two leading organizations on the academic research side, both UCSF and West Virginia University. And, we know and we've seen from our users who have come forward and said, hey, my readiness score is low today. My body temperature was elevated. My respiratory rate was elevated, or even my heart rate and heart rate variability. And some of the early data, I think one of the researchers at West Virginia, they put out a press release saying that they're seeing changes in human physiology, these signals we're collecting, up to 3 days in advance. And that's early. Obviously, still a lot more research to go. But I do think that we know, hey, certain things happen. Even last flu season, Fitbit published some research showing how heart rates are generally elevated during certain periods of the flu, depending on where you are. And so I think we know as a country and globally that these kind of signals can help us learn more about how these diseases spread, these illnesses spread. And I think the early research is looking promising.
You say the data shows that you can identify symptoms of COVID 19 up to 3 days before they actually appear. What's the science behind that?
Yeah. So we looked at these four metrics, both respiratory rate, temperature, perhaps the most meaningful and the biggest differentiator for us, and heart rate variability. And, we have people's baselines who've been using the product for a little bit of time, some up to 2 years. And what they found is all of a sudden they'll start to see a change when people get sick before symptoms, before they even feel it. And literally that's what happened. We had a user in Finland during COVID-19. He came forward and wrote a post, and he said that he's normally 80s or 90s in his score. He's an athlete, he's a skier, he's a competitive runner as well. And all of a sudden his readiness score one day was 54. And he said that he didn't think anything of it, didn't feel that bad, but then he noticed in the app his temperature was high. He then in turn went out and actually got tested for COVID-19 because he had been traveling the prior week, and turned out he was positive. And so he didn't really ever get any symptoms. He described himself as asymptomatic. And, he still saw small, minute changes in his data. And he wouldn't even thought to have grabbed a thermometer, or anything like that. So I think, we need to collect a lot more data. The more we can collect, data scientists and researchers, a lot more and more data. And I think, frankly, organizations like the NBA also thought about that. How can we do everything we can to make this environment safe in the bubble? How can we give our players, our staff, other people in the bubble peace of mind and safety? And even if that means, hey, this isn't proven yet, this isn't some medical device. It's still very early days. But how can we give people that peace of mind and frankly learn from it, and not just learn during this pandemic, but future pandemics and even the general flu season every year?
You mentioned it. This is not officially a medical device, but it is a monitoring system. How have the players responded to the idea of being able to monitor everything that's going on in their body just by one ring on their finger?
Look, most wearables today are not actually medical devices. Apple Watch or Fitbit, they're consumer devices, right? And obviously ourselves, Aura as well. I think we worked really hard with the NBA, the NBA PA, different agencies like Excel Sports, CIA, to get an idea of what would make this data safe and not compromise a player. And so what we all were able to, innovate together on was, hey, why not actually give this data directly to the PA, right, and give the data to the league, the NBA. So this way, no team is seeing, hey, is this player's data looking worse, and should I bench them today? Because that could be totally misuse of data, negative consequences, and that's even happened in the past with players talking about we don't want to wear these things. But by allowing the teams not to access the data, and the data just go to the PA and the NBA, and let them run all the medical tests for COVID, was a framework that really makes a lot of sense. So here we're just passing on an aggregated illness score, that shows the risk that someone may be getting sick, and only if this risk score is above a certain level would someone from the NBA PA call a team doctor, and they wouldn't even say what the score is. They would just say, hey, we recommend getting another test today. And so I think it's the first step, of how to create a framework in some of these interesting situations. But we wanted to make sure the players' data was protected. we wanted to work with the PA and the NBA. We wanted to get input from the leading, agents and agencies of the world to make sure we were doing this the right way.
Is this something that's going to be made available to each player, or is the NBA strongly suggesting each player wear this?
Yeah, no, it's a good question again, and really, it's the NBA and the NBA PA are making it available, right? So teams don't have to pay for it, players don't have to pay for it, and staff same thing. And so it's totally opt in and voluntary. Luckily, we've had players that have in teams that have been using our devices already to help actually, as you mentioned, sort of our core focus on their sleep and recovery and performance on the court. And I think that has helped too. Frankly, a lot of those players were advocates to the PA and their support for this if we could figure out the data side. And I think that's what's led to this happening. So, we think, we're happy and excited, really whoever is using this inside the bubble. It's interesting times. The players are being encouraged, as is all staff, to enroll in some of these research studies to help future organizations learn. And I couldn't be happier that we're doing it together.